All right, now I'd like to turn it over to Dr. Rebecca Haines-Saah. Rebecca is Associate Professor, Department of Community Health Sciences at the University of Calgary. And I just want to point out, while I'm giving everyone a very short introduction, there's more detail about them in our website, and I would encourage you to check them out. Stellar resumes. So, Rebecca, over to you.
So hi, everyone. Thanks for the introduction, Rob, and I'm really happy to be here with these fellow panelists. I am going to talk about a different area from what we've heard about so far, but it's one of what we call the 4 pillars of drug policy or drug strategy. And we have this 4 pillars approach that was originally developed decades ago in Vancouver, and that includes prevention, treatment, harm reduction, and enforcement. So as a youth substance use researcher and someone who's been working with young people for 25 years, I'm going to talk about prevention because I know I can see from the photos here and the avatars that many of you are parents, grandparents, community members. And one of the things that comes up repeatedly when we're talking about our drug poisoning death crisis is, well, we just need to prevent this. We need to get into schools. We need to reach young people. We need to prevent this problem before it starts. Unfortunately, there is a lot of myths and misinformation about prevention and what actually works. So I'm going to give you my top 3 messages about prevention. So what I like to start with when I'm doing this talk is just forget everything you think you know about teens and drug use. Let's wipe the slate clean, because a lot of the things that we've been taught as young people, as parents, or that we see in popular culture, that we hear, in the common social discourse, is actually incorrect and doesn't actually work if we want to keep teens safer and stop them from experimenting with substances. So my first big message as a youth prevention researcher is that just say no, fear-based messaging and trying to scare young people and stigmatizing drug use to keep them away from it by like graphic and gory images, this actually doesn't have evidence of effectiveness. We hear repeatedly from various people, we just need to scare kids. We need programs where we take them to the morgue and we show them, we have a program called the Party Program where we show them car accidents from drunk driving. This actually doesn't get at the social and contextual peer-based context where youth are using substances. It may scare some of those kids, but it really does a big disservice to those who we call experimenters or sensation seekers who are seeking out new experiences, which actually is very normal during adolescence. So it's not a strategy to lecture kids to say, just say no. It's not an effective strategy. It doesn't support them in making better choices. It may scare some of the kids some of the time, but it doesn't actually provide them with information they can use. Okay, I've kind of touched on this already, but my number 2 message is that preventing any experimentation isn't a realistic goal for young people. The average age of initiating substances in Canada across the board for young people in grades 7 to 12, when you look at surveys of that population, a nationally representative sample, it's about 14. Not surprisingly, this is the same age where youth initiate sexual activity. So that's become more of a controversial topic in our current discourse, but we came a long way because of the AIDS epidemic, which was a public health crisis where, we wanted to have fact-based education for young people. We wanted young people to have consent. We wanted young people to understand contraception and how to protect themselves. We need the same fact-based education for drug use. If we could prevent all young people from using substances or experimenting in sexuality, until they were age 20 or 25, we'd really live in a utopian society, right? This isn't the norm in adolescent culture. We need to, open our eyes and have conversations. This isn't about encouraging use, as we know from providing sexuality education in schools. This isn't about endorsing drug use for young people. It's about giving them facts to keep themselves and their friends safer. My third message, which seems kind of counterintuitive, but I think is the most important one of all. And it's actually the most important one for all of you here, because you are all community members who care about your community. And maybe you're not drug policy experts, and that's okay, because you don't have to be, because the best drug prevention is not about drugs, actually. If we want to get upstream, if we want to take a real public health approach, the best drug prevention for young people is about ending poverty. It is about targeting homophobia, racism, xenophobia, colonialism, exclusion. When we have these inequities deepening in schools and communities, that's when we see young people turning to substances. At the epidemiological population level, this is when we see what we call deaths of despair. So an increase in overdose deaths, an increase in suicide. As has already been pointed out, we have a toxic drug supply where even casual experimenters are at risk. But when we see rates climb, it's also because we have deep division and inequities in our society. So providing community-based programs, addressing food insecurity, providing activities for young people, this is where we really provide alternatives to substance use and we make people feel included and hopeful. So there's less turning to substances for coping. And again, this is outside providing health services and treatment. This is where we can really see a change. I only have a few minutes and I don't want to go over time, but in case you were a little skeptical of my points, I want to just back it up by showing you just a taste of some of the horrible things we've done in drug prevention for teens that's really been harmful and ineffective. I'll skip over this slide. It's kind of for questions about what works and what doesn't, and I'm happy to provide this to Rob to share with you. But the just say no approach that we hear so often is actually nothing to do with evidence or science. It was something developed by the former First Lady, Nancy Reagan. She just casually mentioned this leaving a summit, right? So just say no really launched a big focus on, negative messaging and drug education, but it was never based on evidence of what worked for keeping young people safer. We also have a strategy based on brain harms, telling young people drugs fry your brain. This is a bit counterintuitive because for some young people who are sensation seekers, they are seeking out something to alter their brains. They want to feel different sensations. They want to feel different. And this type of messaging actually doesn't provide you with any information. This is your brain on drugs. Any questions? If I'm 14, yeah, I actually have a lot of questions here. You're not really telling me much. Another drug education misstep that we've done, we used to come around with the drug education suitcase. So when we roll into schools and we're showing young people a bunch of different drugs and drug paraphernalia, again, not helpful or effective for them navigating their social worlds. And when you do this kind of information dump, whether you're showing them the drugs or you're putting up slides and walking them through every drug and the effects on the bodies, it actually introduces young people to a range of drugs that they may not have known about. So we're really moving away from these kind of universal approaches that give so much information to everyone, and instead focusing on things like building safer school communities, social and emotional learning, problem-based, solving problems for peers, strengthening those skills that are protective for all kinds of risk-taking, not just substances. And then finally, adults so often get it wrong. Here are some of the worst, and I'm so sorry to Leduc, which is here in Alberta, but here are some of just like the worst cannabis messaging that was rolled out around legalization. If you have young people in your lives, you know that an eggplant doesn't mean lazy. It means something totally different in teen texting culture. But this is what the Quebec Psychiatric Association pushed out to young people. We've just done such silly, patronizing money wasting campaigns that it's really tiring as a prevention researcher to see this done over and over. And then one more, and I'm sorry, I should have put a little warning because the slide has some disturbing imagery, but Health Canada, other campaigns from private, nonprofits, so many campaigns have relied on very stigmatizing, very unethical images of people using substances of many ages and walks of life. And this is actually, I think, a form of violence to us, people who love people who use drugs and people who have people using drugs as our friends and family. So I will just end on that with a little bit of a controversial imagery, but thank you so much. And I have this top 10 list of things that are myths and don't work, and I'm happy to share that. Thank you so much.
So, Rebecca, what does work?
I mean, at a basic level, if we're talking about if you have a young person in your life, Instead of saying just say no, open communication, trust and respect, modeling that dialogue, modeling that acceptance without judgment. Teens are going to take risks. They're going to experiment. They're going to mess up. They're going to make mistakes. They need to know that you will be there for them and you will support them. This doesn't mean that you don't have any boundaries and you don't have, some type of expectations that are appropriate for your family, maybe the risk factors in that teen's life, maybe your faith-based reasons, but you can sort of build that open communication trust. Also, what we as parents model for our young people around how we're using substances. And then beyond that, in school-based settings, we do have really good outcomes from some trials of things where kids do things called the good behavior game, where they're learning to interact with each other. They're learning to resolve conflicts among peers. At the big community level, we see things like the Icelandic model, where they reduce substance use prevalence in young people by half, not by targeting drugs, but providing free recreation, free sports, parent support groups, and a bit more controversial in that model because they have a very uniform society. They had a youth curfew, which I don't think is possible to implement in Canadian jurisdictions. But, they took a totally different approach. And that's what we call like getting upstream rather than just talking to kids about drugs.
That's interesting. I hadn't heard that about a nationwide curfew in Iceland. Wow.
Well, they have very, very high rates of substance use in the winter months, right? Very high prevalence for young people.
Okay. And it just seems though with young people, I know, well, I have 3 daughters that are in their 20s now. And so, having gone through that stage in life, and all of us were teens as well. Also too, at a time we had to try to develop in our community, a youth center, but the youth just didn't see. It seems like if you're having an adult-led program, or it just doesn't seem to connect.
Yeah. That's a great point, Rob. I think we forget that teens are a different culture and they are a different mindset. And any program you're developing for teenagers, they have to be at the table. They have to have input. I just ran a workshop all weekend with young people, and I had peer support there that was their age, that was working with young people and was their, go-to when they had an issue. You absolutely need that. You wouldn't design a program for women and never talk to women, right? It's very much the same for teens.
I guess though we all have had lived experience as teens, but the experience changes over time.
It very much changes. It's being in a different, I'm a youth researcher, but I'm 50, so I can't rely on what my experience was all those years ago.
Thank you very much for that.